This is your Nitronox machine. This shows you your nitrous pressure, your oxygen pressure, and the pressure of the mixture, two together. You want to make sure you have 2 full tanks. This tank is full. We don't have a second one just yet. We're still waiting on that one. You want to make sure your scavenger is attached. This is the scavenger, this piece right here. And you want to make sure your setup is correct for your Nitronox. The machine is not connected to your nitrous oxide. Simply line up the pieces and you're going to hand tighten it. To open the nitrous, you're going to give it a full 360-degree turn. And you should see your pressure gauge drop or increase to about 750. That tells you you should have a full tank. To shut off your nitrous, give it a full backwards counter or clockwise turn until you feel tension. Now note that the pressure gauge doesn't change. It still stays at 750, but your nitrous is off because it is hand tightened. It will stay on at 750. The first step is to take your demand valve and you're going to plug it into your Porter Nitronox machine. It's going to go right here and you should hear it click. And then it gets placed right here. And on the back of your machine, you're going to see a little gate. When you close the gate, this line should align with this piece here. And now it's closed. And you can use this knob to tighten it. Connect your oxygen to the wall. Now connect your vacuum to the wall. Next, you're going to take your patient tubing and attach it to the demand valve right here. If you notice, the blue is the part that's getting connected. Make sure all these caps are tightened. There should be 2, one there and one at the top right here. Those should both be tightened. And that prevents leakage of nitrous oxide into the room. Next, you're going to connect the pink tubing to your scavenger. Pink goes to the black piece. To ensure the nitrous oxide is completely evacuated into the system of the hospital, make sure that this valve is pointed at the 6 o'clock direction. If you hear this sound, that means your Nitronox is connected correctly. Last, you will connect your mass to the Nitronox machine. And now your nitrous is ready to use. To take apart the nitrous, you're going to make sure that your nitrous is closed all the way. Hand tighten it. And you're going to make sure your scavenger is set to the 9 o'clock position. That makes sure that your vacuum is closed. Disconnect your vacuum. Disconnect your oxygen. Next, you're going to take off the patient mask and connections. And these are one-time use only. So these pieces, the mask, the blue and the pink, all together get thrown away into the red biohazard bin. Cavity wipes, sanding cloths can be used on all parts of the machine except for the face. Per the manufacturer, they would like us to use alcohol to wipe the face, as the sanding wipes can possibly cause condensation to build up within the dials. Your demand valve pops out, and there is a release button right here. You can wipe this with the Sani wipe. Do not take it apart. Leave it together in one piece, and this goes back into the Pyxis under your patient's name that you pulled it out from underneath. Once you have wiped down the nitrous machine, please make sure you place it back into the medication room where it can be stored. If you have emptied your nitrous canister, please ensure that you replace it with 2 full ones. Please talk to your charge nurse regarding where you can get a full canister of nitrous oxide. According to the manufacturer, the nitrous machine is safe to use with COVID-positive patients. The most important thing to remember is that the patients must inhale and exhale completely into the mask if they are to use it properly. This minimizes the exposure of aerosols generated by the patient.